Welcome to The Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome back to the Consult Before the Cut. We are here today to discuss something that is going to be fun for everybody, I think, to listen, very educational. We're doing an educational, a little TED Talk today. But before we get started, I want to thank Rejuvime Medical, your age-defying clinic. We're defying all odds with our hormone replacement therapy, GLP-1s, peptides, and everything you need to keep you going. Also, we'd like to thank Weiler Plastic Surgery Group, the largest plastic surgery group in Louisiana, with 5 board-certified plastic surgeons, a whole bunch of fantastic expert injectors and estheticians to keep you glowing and feeling and looking your best. So we thank both of them so much for having us here today. And that kind of leads us into... we're going to, like I said, we're going to do like a little TED Talk today. But it's called yes, it is, because they're very informational. They're very informational.
I agree. I think so. I'm gonna expound on it just a bit. So I have, Rejuvime is obviously, I think at the cutting edge, right? Hormone management, GLP-1s, the peptides, longevity, right? So longevity is
where this comes.
Longevity,
right? And I think longevity is a little bit of a misnomer. So, the practice or as this longevity medicine develops, it's not necessarily to extend the life. Okay. We can't, there may be some breakthrough thing that can extend the life, but it's more about quality of life as we age. And I've gotten a little bit into like the Peter Attia, whether you love him or hate him, whether he got wrapped up in the Epstein files recently. He may not have been Epstein's personal doctor, to be determined. But I think he brought to light a lot of concepts. And, he talks about the 4 horsemen, or sort of the 4 pillars of aging. And me and Britt were talking about this earlier, right? Cardiovascular issues, diabetes, right? Or metabolic issues, cancer, right? And then the 4th one is mental, brain, Alzheimer's, dementia, right? Clarity of thought as you get older, right? And so this man, Attia, has a very, very small practice, very exclusive, expensive practice, right? Where he really is a longevity physician to people with a lot of money that want to get every ounce out of life that they can. And so I think it's, we're developing a program at Rejuvime for longevity. And I think we're all at the age where a lot of us have maybe a little older or younger, but we've all been through periods of time where our parents have aged and or relatives, and seen the effects of
the process
of mental deterioration or whatever. And we have an expert here today, which is going to be fascinating to have a discussion. And we're going to try to relate what our expert, he's probably going to have a knowledge above most of us, right? So experts usually do, but we're going to try to relate that knowledge into some, I think, real world thoughts and some real world actions, maybe that, or just start to thinking about it, right? And learning about it a little more. So I don't necessarily say it's a TED Talk.
Yes, it is. Every TED Talk that I've ever watched, I've learned something.
You'll learn something, but hopefully,
you'll learn something today.
Hopefully we can get a few like actionable or some things to think about.
Some takeaways.
Some takeaways. Does that make sense?
Hints
that you're going to,
Right. That may help somebody who's maybe has a history of this in a family, or maybe somebody whose parents going through it, or maybe they're fearful of this happening to them.
Yeah.
I don't know.
Without further ado.
Yeah.
Introduce
the young man.
Mr. Rob. Okay, now I'm not going to butcher your last name because Chase, I can't say your last name either.
Bruyette.
Is
it Bruyette or Bruyere?
It's bruyette. Like have you
Bruyette.
put the coffee on to bruyette.
To bruyette. I had to put the coffee on to bruyette.
Trace, why don't you tell us that? So
Trace, get
this
better.
is the father of a young man that works here.
That's so good, Bruyette. Okay.
Yeah, the coffee had
bruyette.
bruyette.
That's
I
good.
love that. See, that's the easy way. And you are the manager of the Institute for Dementia Research and Prevention at Pennington Biomedical.
Correct.
Love that. So Pennington Biomedical.
Well, give us a little background on you. Where are you from?
I was born and raised in Shreveport.
Okay.
Went to school in Monroe.
Okay.
Northeast Louisiana University. They call it ULM now. I don't
ULM.
accept that name. And met my wife there, and
Okay.
I've been living in Baton Rouge for the past 35 years, and developed a career in neuropsychology.
Okay.
I started out first at Neuromedical,
Uh-huh.
doing cognitive assessments, and
Okay.
then for the
Neuromed here in Baton Rouge?
Yes.
Okay.
And-
That's been around for a long time, Neuromed, right?
Yeah, it's been around for a long time. Yeah. And then for the past 17 years, I've been the manager. I kind of grew this love for the geriatric population and a growing interest in dementia.
Right.
And so I got the opportunity to go to Pennington and be involved in dementia research. And I've been there for 17 years.
Wow.
Let me ask you this, because I am in the middle. I've read the Peter Attia book, and he talks about some fabulous dementia researchers that almost were always motivated by an event in their life or a family member, an uncle or an aunt. Was there a specific, you said you sort of
Yeah, we're
gravitated
motivated to,
to
yeah.
the geriatric dementia population? What sort of, is there just something you enjoyed? Was there a specific,
I just like old people.
like old people? Okay. Yeah. I
mean,
think so, my
it-
wife is the same way. She loves.
No, it's really
yeah.
it's really as simple as that.
Right.
I mean, and you know the geriatric population is often kind of disregarded.
Yes.
Pushed to the side.
Push to
You
the
know,
side.
and if you just sit and talk with an
Have a
aging
story.
individual,
Yeah.
there's so much freaking wisdom, and there's so much storytelling, and
Yeah.
and so that's kind of what drew me to that population is
Uh-huh.
like those. It's like, hey, let me tell you something, Rob.
Right.
You know, and they go off on this long dialogue
Yeah.
story and everything, and I'm like, man, that's
It's cool. The
that's
knowledge.
really
Yeah.
cool.
Yeah.
And there's so much wisdom there.
Yeah.
And people ignore it because it's like, oh, this is just some rambling
Right.
old person.
Right.
Yeah.
Right.
No,
That's
no,
good.
you gotta listen to
Yeah.
them.
You do.
My favorite clinical that I ever did in nursing school was at the Louisiana War Veterans Home, and I was on their memory unit. And one of the guys that I took care of was a boxer for LSU.
Wow.
Oh, yeah.
And he was absolutely, I will never forget him for as long as I
Right.
live. But I mean, could not remember anything at all, but he remembered that he was a boxer.
Yeah.
And
That's
he
so
was,
cool.
and he was like a champion.
Well,
but
I'm
I love
a
them.
bard at heart, so I love storytellers,
Mhm.
and old people are storytellers.
Yeah.
Yep. And they have a lot of stories to tell.
Yes.
They have a lot of stories
And if you
to
just
tell.
stop and listen, it's a beautiful thing.
Yeah.
Yeah. And I think life these days goes so quickly
Mm-hmm.
and it's so easy for us. You know, we wake up, our hot water, food's
Yeah.
there, we cook. When I was working at Hammond, a guy came in, he was 100 years old. You may remember him, and he grew up, he told me a story. So he lived on a farm. They would have to wake up, start the fire, go get the chicken, all right? Get the eggs, okay? Bake the bread every day in the morning, get the eggs, make a fried egg sandwich to bring to school for lunch.
That's
This is
it.
all
No.
before they went to school
No.
at 8 a.m.
It's amazing.
It's amazing.
I
Like
mean, you're
baking bread,
boiling eggs
I mean,
in
like,
bulk.
No. So many great stories.
just to make a
Yeah.
that you hear from that generation. You
Yeah.
know, it's just amazing. You know,
Right.
and they want to tell those
Yep.
stories. They want to let you know what their life was
Mhm.
like.
Yeah.
And I just that's why I got drawn to the population and to work with geriatrics. I mean, everybody, you know, coming up, we want to work with the kids. We want to
Right.
help the kids. We want to
Right.
help the kids. Well, who's going to help the elderly?
Yeah.
Mm-hmm.
And I chose the path to help the elderly.
And I think it's interesting. Maybe this is just my perception, but I feel like the elderly was somewhat obviously ignored back in the day, right?
Mhm.
And
Right.
so, and this was just all this disease that we're going to talk about was, oh, you're old. that's what happens when you get old.
Right.
Mm-hmm.
Like, go sit in your room, go get locked up in a cell, and you're old, your life's over with. And now as our quality of life is improving as we get older, and we're living more vivaciously as we get older, we all of a sudden realize, well, not functioning at a high neurological level as you get older is really hurting the quality of your life. And it's a disease, right? It's not just a natural process of everyone ages like that. So I think it's fascinating.
Yeah.
Fascinating. So
I want to dive in.
Yeah,
I
let's
know.
get into-
I'm like, I have so many questions.
can we define a few things? Because I think, first of all, like, when I walked in, you pulled out the
Oh, don't say it.
oh,
It's
sorry,
a
go ahead.
surprise.
Okay.
Is this when we talk about the difference between Alzheimer's
Yeah.
versus
Yeah.
dementia?
So, I mean,
Okay,
there's an important distinction to make. And it's not, everybody classifies all dementias as Alzheimer's disease. It's kind of what there's one researcher who calls Alzheimer's disease a clinical wastebasket because everybody gets tossed into it.
Mm-hmm.
Not all dementias are Alzheimer's.
Mm-hmm.
So if I hold this up in
Mhm.
front of somebody
Mm-hmm.
or in front of 100 people, 80% of them are going to say it's what?
A Kleenex.
Kleenex.
It's not.
Right.
It's a tissue.
Right.
So not all dementias are Alzheimer's, but we get to the point where that's how people are classified.
Right.
And there's really no definitive diagnosis except post-mortem. You don't really know.
Yeah.
And when we look at the post-mortem brains, for the most part, it's always mixed dementia.
Right.
Okay. It's not pure Alzheimer's.
Right.
What Alzheimer's saw was a 50-year-old woman, with early onset cognitive symptoms.
Right.
That's different from what we see in the 80-year-old, right? And so what you'll see in those postmortem analyses are vascular
Mm-hmm.
Right.
problems. Most dementias are vascular related.
So I'm going to do a little bit of interpretation, Ben,
Go ahead.
because some of our postmortem for our viewers
Uh-huh.
is after you die, right?
And they
Yeah.
look at your
If they
brain.
look at your brain, they take your little skull off and they take a look at the brain, right? And then you mentioned what Alzheimer saw, right? And so there was a doctor, Alzheimer, right?
Right.
Who back in 20s or 30s, it was a long time ago,
Yeah,
right?
yeah.
They used to lock people up in insane asylums or asylums, right?
Right.
So if you had dementia, you were nuts, you were crazy, you locked up in an asylum, right? And if I'm referring to the right patient, it was a 50-year-old lady, right? That was locked up,
Right.
and was demented, right?
Mhm.
And people were just like, oh, you just go crazy as you get older. So 50 at that time was old.
Yeah. That's it.
Right? Isn't that crazy? You were like considered, just lock them up.
That's it.
And I think he did some postmortem,
Well, but the thing
On her, right?
Well, yeah, but
and that's how it was all started.
the genetic form of the disease
Uh-huh.
is usually characterized by early onset
Correct.
prior to the age of 60.
Right.
Right. What we see with the age-related dementias, I mean, by the time you reach the age of 85, you've got a 50% chance of some form of age-related dementia.
Right.
Okay. But usually that comes as part of, other factors that cause the brain to age,
Right.
which is not
Alzheimer's.
true Alzheimer's.
Right.
Mm-hmm.
So for our view audience, so if you were to say, hey, there's two distinct sort of brain processes, right? Would you say Alzheimer's is more of a distinct sort of disease and dementia is more of an aging,
Age-related
multi-related
process. Yes.
kind of thing?
Mhm.
It's multifactorial.
Multifactorial.
It's related to. It's not that you inherit Alzheimer's disease. I mean, and people get scared because they're like, my mom died of
Right.
Alzheimer's. Well,
Right.
how old was she?
Right.
Well, she was 87. I'm
Right.
like, well, how long do you want to live?
Right.
And it's usually multifactorial. It's usually related to risk factors that we see: high cholesterol,
Mhm.
diabetes,
Mhm.
hypertension.
Yep.
All of these things that are putting strain,
Obesity.
Mm-hmm.
obesity, all of these things that are putting strain on the brain.
Right.
Okay, they're taxing the brain.
Right.
So the fact of the matter is that we've done such a great job of managing other physical illnesses
Right.
that people are living long enough for the brain to.
For the brain to give out.
Yep.
Yeah. So as opposed to the body causing problems to the brain,
Yeah.
we're living long enough now that our brains are hitting a wall.
Right.
Yeah.
Right. So we're treating heart disease, we're treating kidney
Mhm.
disease, we're treating liver disease, we're treating all these diseases processes that allow us to live longer. Well, the brain's going to fail. It's
It's a matter of time.
It's aging.
Yeah. It's
Yeah.
aging.
Right.
yeah.
It's almost like I tell patients, almost everybody gets cancer, right? At some
Right.
point, right? If you live long enough, you're
Yeah.
either going to die from it or you're going to conquer it and get it. But if you live long enough, at some point, something's going to go a little awry in your body and you're going to develop, whether it's a skin cancer, which is
Right.
like a negligible
Yeah.
thing, or a serious cancer, which is like a pancreatic or a lung. But almost everybody is going to have that problem, right? And so what you're saying is Alzheimer's is different than dementia. Almost everybody's going to have some sort of cognitive or brain impairment, but Alzheimer's is a more distinct, can be an early onset, right?
It's usually
be-
characterized by early
Right.
onset.
And that's
Yeah.
probably why it makes it a little bit scarier too, I think, right?
Yeah. Yeah.
It's because you
Younger.
can be struck at 60, right?
Right.
Or
Yeah.
55, right?
Yeah. And that's I want to make that distinction. That's the genetic form of the disease.
Right.
Mhm.
Is the early onset version.
Okay.
I mean, most dementias are not characterized by that,
Right.
but they're still characterized as Alzheimer's,
Right.
because that's just the term that everybody likes to use,
Likes to use.
but it's not. It's age-related dementia. It's
Right.
it's metabolic disease.
Right.
It's aging, and the brain fails.
Right.
I mean, it's bound to happen.
If it is age-related dementia and we are trying to get ahead of it and stay on top of preventing that, what are ways that we can do that?
What are some preventative measures that we can put in place? Or is there?
Oh, there are.
Is there specific identified things that you could do to help?
We've had several studies at Pennington where we've looked at exercise interventions, and just people have this misconception that you can exercise the brain. You can't.
Yeah. It makes me think of all of the apps where they're like,
No.
do this. for
Wait,
help.
really?
What?
The brain is not
A
a
muscle.
muscle. Okay? You can't exercise it. You can do all the Sudoku that you want to, all the crossword
Yes.
puzzles that you want to, and that ain't going to do a
Crossword.
damn thing.
My
No.
grandma was so sharp, and we always said it was all those crossword
All
puzzles.
those
she did.
crossword puzzles that
No,
she
what you
did.
need to do is just take a global approach to it, and that's diet and exercise. If it's healthy for the heart, it's healthy for the brain.
Right.
Right.
Okay, so Mediterranean diet, and I say exercise, but there's no dosage of exercise.
Right.
I mean, you can go to the gym and walk on the treadmill for 60 minutes, and then what do? You go home and sit on a couch and eat Doritos for the rest of the day?
Right.
That ain't helping.
Right.
What you need is constant, continual activity
Yeah.
to keep the blood flow.
Mm-hmm.
You want to keep the blood flow up to nourish the brain. So what we have found is in our research is that, constant daily activity is the most beneficial.
Yes.
Better than a high dose of 60 minutes on a treadmill and go home. Just move throughout the day.
Throughout the day.
And that means 10,000 steps.
Right.
So 5,000, anything other than 5,000 is sedentary behavior,
Really.
and that is unhealthy.
Do you just walk at the end of the day sometimes?
What you mean?
Do you have
Like
an Apple Watch?
I
I don't know. Do you move enough?
Me? I think I stand a lot. I do try to walk.
I'm serious.
As a surgeon. No, I do. I do.
He is active in
Right.
surgery, but then it's hard if you pay
But-
attention to get in 10,000 steps a day.
Yeah.
It takes
No,
effort.
I
Oh, yeah.
feel better. I've started, this is a whole nother conversation. I have started because honestly, being fit and moving
I know.
are two different
Very
things,
different.
right? And I want to say this because I always like to be simple. So you talked about blood flow to the brain, and I always tell, as a surgeon, I went through the ICU and all this, and really, there's a reason your heart in my opinion, points up and pushes the blood up, because the most important organ is the brain. So when you get sick, and you know this as nurses, right, and as PAs, your body preserves the most important organ.
Yep.
Right.
So it starts to shut down blood flow to the extremities, right? It'll shut blood, then it shuts blood flow down to your kidneys and your bladder, right? Then it shuts down to your pancreas and your livers, right? Still, you got to feed the heart because it pumps, and you got to feed the brain last. So, it really is in blood flow. And like you said, all these different factors, it's all about maximizing health, but really maximizing, you said, blood flow.
Yep.
Feeding,
right.
feeding that organ.
And controlling the risk factors.
Right.
Yeah.
The diabetes and the
Right.
hypertension, the high cholesterol.
Right.
Controlling those risk factors will increase longevity.
Right.
And preserve brain health. But we're getting better at that. We're not there yet.
No,
because people don't go. They don't go to their doctor.
No, they don't go to doctors. Let me ask you this, because this is a phenomenon I see a lot too, and then we'll take a break. But so you'll see men and women that have worked their whole life and continue to work at a good level, and then maybe they're forced into retirement or they lose their job, and then there's a sudden neuro decline.
Right.
And we said there's no exercising the brain, but
I know.
do think
I'm fighting that a little bit.
Well, I think it's two different things. I don't think you can do things to necessarily, like you said, pump it like an organ, right?
Yeah.
But I think use it or lose it.
I'm not saying
is that applicable? Use it or lose it?
I'm not saying that those things are bad.
Right.
Okay. I'm just saying that from what we've learned in our research, physical activity
Is number one.
Is number one over doing crossword puzzles and sitting on your ass all day.
Okay.
But you say that. Think about it. You have the individual that's forced into retirement. What is that individual doing?
Sitting on a couch.
Sitting and not doing anything.
He becomes
lose that
sedentary.
activity.
Yeah.
You're right.
He becomes sedentary.
You're right.
And then he deteriorates.
Yeah. And I'm fascinated with this topic because I see it I have patients that, obviously I do aesthetic elective procedures. It always fascinates me. Someone comes in at 60 and you're like, God, you look so old. And you're just, and then I have patients that come in their late 80s or early 90s.
Looking amazing.
Looking this zest for life. Oh, I'm headed to, remember we had that patient, I did a male facelift and I call him up for the follow-up. He's in Vegas.
Yeah.
He's 91 years old. He's like, I'm in a casino. I'll call you back. I'm up real big. I'm like, damn, this guy is awesome.
He's just doing it.
He's just doing it. And I think it's that activity. He's just always going, right?
And again, it doesn't have to be a gym membership.
Right.
It doesn't have to be pumping weights.
Right.
I tell people, I'm a behaviorist at heart. And I'm like, there are things that you can do that are really not that complicated.
Right.
So that you remain physically active. And one of the examples that I like to give is, how many times have you gone to Target or Walmart and driven around the parking lot looking for the closest freaking parking space that you can find? Don't do that.
Park in the back.
Park in the back.
I love that.
I mean, if the weather is fine, park
Rob,
in
tell
the
that
back.
to my wife.
And
why are you parking back here?
and walk in, and by the time you've done your tour around the grocery store, you got 3,000 steps.
You go.
Yeah.
Big stores these days. You're moving.
You know what I mean?
That's
but it's a very simple, very, very simple
concept
way to you don't really need intense activity. You need constant activity.
Yeah.
Yeah.
Let's take a break and come back.
Because I want to talk about like treatments and kind of stuff like that.
Yeah, studies and things like that.
Yeah, I do want to do that. So everybody hang tight. We will be right back to continue this conversation.
I'm Ashley Shelley. I'm from Baton Rouge, and I've had Sculptra, Botox, and aesthetic procedures at Weiler. I realized that it was time to start taking care of my skin. There were certain concerns that I had, loss of volume in my face and the texture. I knew that I needed to do something about it. Sculptra has boosted my self-esteem and increased my confidence in my skin. I'm 40 years old, and my skin has never looked better than it does now.
My name is Amber. I'm from Denham Springs, Louisiana, and I'm currently on semaglutide. I started my weight loss journey a few years prior and just kind of struggled with getting to like that final weight loss goal. I decided to get on semaglutide because I was really working towards like those last 20 pounds. Working with Rejuvime is so simple. When you really have that person that's like in your corner, like they're cheering you on, they want to see you hit those goals. I feel like I'm healthier, I'm at that wonderful weight. I just feel really confident, feel comfortable in my skin.
All right, everyone, welcome back to our conversation today. We're talking about what really works to prevent not just Alzheimer's, really, but because as we learned in our earlier segment, that tends to be related to the genetic side of things. But really talking about dementia, Alzheimer's, and everything. So I know you wanted to come back and were we saying you wanted to ask something? I said I wanted to talk about treatments, but I thought you said something.
I think as long as our audience understands there is difference between sort of a age-related dementia and Alzheimer's, right?
Yes.
And understands that. We did talk about activity levels are important, right? I think.
What is the pathology behind Alzheimer's?
Mm-hmm.
What
makes it different than dementia?
No, what causes
dementia?
What causes Alzheimer's?
Do we know
Isn't
exactly?
It build up?
No,
we don't.
I think there's a lot of misconceptions, right? We used to talk about Lewy bodies.
Lewy bodies. That's what I'm.
But a lot of that's sort of
gone
away, right?
tau proteins.
Yeah.
And plaques.
Mm-hmm.
Amyloid plaques.
That's what you see. Is
that's the rabbit hole that we've gone down.
Right.
But as we're coming to learn more and more about it, it's like, is the presence of amyloid plaques really the cause?
Right.
Or is it the body's natural immune response to put the plaques in the brain to tamp down this undergoing inflammation in the brain?
Right.
So, competing theories on that.
Right.
Nothing decisive.
Yep.
But, we've been chasing that for a long time. The whole idea that amyloid plaques are the cause of Alzheimer's disease. And I don't really believe that personally.
Okay, but on a scan, is that how you differentiate seeing the amyloid plaques versus in a dementia patient that will not have it? Like,
well, you could see, the thing of it is you could do a PET scan and you can detect amyloid plaques. Okay. But the fact of the matter is you can have someone who has severe amyloid plaques and is not demented.
And no disease. No presence of
no
dementia.
presence of any symptomology whatsoever, but there's amyloid plaques.
Right.
So, it's kind of come down to where, like, are we chasing the wrong route?
So they're basing the onset of this disease more as Alzheimer's is in a younger population versus dementia's in the later population.
Yes.
The age-related dementia.
Age-related.
Age-related dementia.
Yes.
Because there's different types.
Lewy bodies and amyloid plaques.
Well, I'll give you an example.
And you mentioned, go ahead. Go ahead.
Yeah, I'll give you an example. I mean, and especially the way that the media interprets this disease and the things that they put out there, which is mostly misconception. I'll give you an example. Headline, USA Today. NFL players with concussions are 3 times more likely to have Alzheimer's disease.
Right.
That's not Alzheimer's disease. Right. That's chronic traumatic encephalopathy. That's a wholly different thing. So you got to be careful. And then they'll put out a breakthrough study and get everybody excited about, hey, can I get this for my mom? And it's a rodent study. It's a rat study. It's a pilot study. And a lot of that doesn't translate to humans. We've cured Alzheimer's disease in rats.
Right.
Genetically engineered rats.
Really?
But it doesn't translate to humans.
Yeah. The rats are remembering the elephant with the things that no need necessary.
It doesn't translate to humans.
Right.
And so you'll read that and people are like,
why not? Why can't I?
Why?
Right.
Can I get access to this medication? I'm like, it's not even been through clinical trials.
So do you see
Wow.
media as helpful or hurtful in where you work in your quest to sort of I don't want to say cure.
I think they create false hope.
False hope.
Yeah.
And I think it's an emotional topic for people.
Yeah.
And people are desperate.
Because everybody's worried about it.
Everybody's
And
worried about
scared.
Yeah.
I mean, it's scary,
it. It is scary.
you know?
It is scary because
I think, and also because like you see individuals, and I know like I said, working in the medical field and stuff like this, you see individuals who don't remember and they become combative or they become sad, and it's a very fearful state that they're in. And then of course you have people that are just pleasantly confused and just, you know, not quite. My grandmother was very pleasantly confused,
Right.
and was just, oh, okay, you know, like as we would tell her. But then you have individuals that when they can't remember, they get scared because they don't recognize anybody around them, you know, and things like that. So I think, like you said, it's a very fearful thing because you don't know if that is something that you're going to get. You don't know what card you're going to draw. Am I going to just be pleasantly confused and happy-go-lucky, or, you know, am I going to be scared? And I think that develops a huge fear in the regular population.
It is a huge fear.
Yeah.
It is a huge fear. And I like to tell most of my patients, I'm like, if you're aware that your memory is not what it was 20 years ago, you're probably okay.
yeah, you're probably
Yeah.
okay.
Yeah.
It's when you're not aware. Right?
Yeah.
Because when if the dementia hits you, you'll be the last one to know.
Yeah.
That's a good
It'll
point.
be the ones around you that are
Right.
saying you're off.
Right. Right.
You know,
It's there.
so if you're aware, I mean, and a lot of times it's just a matter of distraction.
Right.
We live in such a distractible environment,
Right.
and it's just kind of like, you know, where am I going? What am I doing? But if you're a 75-year-old person and you're like, hey, you know, I'm kind of forgetful, I don't remember these things or whatever, you're probably okay.
Right.
Because you can't remember everything you've forgotten.
Yeah. No, you're right.
You can't.
Let me ask you this. So we talked about there's some obvious things you can do to hopefully prevent, you know, dementia, whether it's such as, you know, exercise, right? Activity level, staying active, managing your blood pressure,
Right.
Not developing diabetes, right? Or if you do, manage it the best you can, right? And usually that involves maintaining a good weight, you know, staying relatively thin. What else besides, is there anything else besides, you know, living healthy, working out?
Yeah, I want to know like supplements.
Is there anything, supplements,
Yeah.
or is there anything like you see the commercials for Prevagen out there, and
Prevagen,
you see like you just like, so Taylor was like, okay, if I do Sudoku for 3 hours a day every day, am I going to prevent that? No, it's not going to help.
Okay,
Taylor.
I'm
Sorry.
serious.
Right.
I like have a very monotonous job,
Uh-huh.
and like I don't solve like insane
that.
I don't
Truly, I'm like I don't use my brain. So saying like deeper, I don't know.
I don't know. I think what you do is pretty
Okay, but you know what I mean. People,
I know
who-
what you do. You just do the same thing every day. You're not
You're
doing
not-
anything new.
Monotonous, more
You're just
so.
doing that. Yeah.
Monotonous.
We're all
That
monotonous.
just,
Yeah.
but I mean,
that's
I think
pretty
it
much
takes a lot of
everybody.
brain.
Pretty much.
Takes a lot of brain. You got a big brain, Ted.
Yeah.
not me specifically. I'm trying to like explain that. Is
Right,
it like
you're
the
not-
monotony, or you don't read? Like, oh my gosh, you don't read. Oh my gosh, your brain is dying. Or
No.
you're not doing those little brain games. My mom does
Brain
this
teasers?
brain teaser on her phone. But she needs to maybe, you know, control her blood pressure more and walk some more.
Well, it makes me think too, the GLP-1s and everything like that. When you're saying, are we going to start seeing a decrease in individuals?
Rob mentioned something about insulin, right?
Yeah.
Yeah, and we've got a study that's coming up at Pennington where we're going to look at insulin therapy for people with Alzheimer's disease and see, you know.
So
what
wait,
comes of
insulin
that.
therapy?
Yeah.
I thought insulin was causing the
No, lack of insulin causes
Right.
diabetes,
right.
right? And so patients typically that like one of the signs of, you know, extremely high glucose levels is
Lack of insulin. Yeah.
mental.
Oh, so you're
like,
saying
mental stability.
supplementing insulin.
Yeah.
Okay,
Yeah.
got it.
Supplement
Okay.
insulin.
Wow.
Yeah, tight insulin control.
Right. Right.
Wow.
So we have a trial that's upcoming for that. As far as, you know, the supplements go, I think it's a racket.
Mhm. Mhm.
I think it's something that
Well, no, I don't disagree. I think, look,
I think
and
it's something that preys on desperation.
I agree.
Prevagen,
Right.
okay, for example. I mean,
I'm
if-
like, pray. I'm being prayed on.
That's what I'm just sitting here thinking about, like Taylor in the morning popping open her vitamin pill back and just like throwing it back. Like,
okay, so let me tell you something.
Or like peptides and NAD, like all that.
We're okay. I think you have to be very specific about this. So I don't think I tend to agree. So taking Prevagen is not going. That alone is not going to prevent a dementia or a problem down the road, right? It's multifactorial, right? There's nothing wrong with good supplements. There's nothing wrong with being healthy, right? But there is, and what you're saying is there's no magic bullet, right?
Well, what I would say is I would put it to you this way. If there was something you could buy over the counter at Walgreens, I'd be out of work.
Yeah, I agree.
And I'm not.
Yeah.
Yeah.
No, I agree with that. I agree with that.
Yeah.
Right.
Now, it's that simple, you know. And I think that, you know, the elderly, you know, they get preyed upon because they're scared.
I agree.
And they're like, I could take all these different supplements and I see all these commercials and, you know, that's going to make my brain healthy. No.
Right. When it's actually exercise, staying active,
diet,
making sure your insulin levels, right? So being healthy and not being overweight or diabetes. It's exercising, building some muscle mass. It's all the things that sort of, you know, are the basis of health.
If it's good for the heart, it's good for the brain.
Good for the brain.
There you go.
Right.
Think about it
So
like that,
good.
Tay.
And that goes back to the Mediterranean diet. And
Yeah.
Is there anything, so you guys have an insulin study. Is there anything out there that you guys, I'm not saying it's a cure, or is there anything that's exciting that you're willing to talk about? Does that make sense? Or like, where do you guys, so you guys are chasing a little bit of insulin, right?
Right.
Anything else out there? I know, what about like, I know a lot of this is going to genetic testing, right? Testing for markers of Alzheimer's and things like that. It's very popular. Is there anything that you guys are excited about
for the future
on the horizon?
Yeah.
Well, let's go back to the genetic markers, okay? Because everybody assumes that because their mom died of Alzheimer's or some form of dementia, that means that it's a death knell for them.
Right.
That's not true.
Right.
But I understand the fear.
Right.
But it's mostly about controlling the risk factors that we've already discussed. In terms of what we're looking at exercise interventions. We're looking at insulin interventions and that sort of thing. And we'll see where it goes. I mean, we've had some really good success with exercise interventions, actually, where the control group was sedentary and the experimental group was more active, and we saw improvement in cognitive testing scores. So we're kind of going down that line.
Do you guys over there, and I don't know enough about it, feel like there's been has there statistically been a rise in the prevalence of Alzheimer's in society? Or is it simply, like you said earlier, we're living a whole lot longer?
We're living a lot longer and there's awareness.
Yeah.
Of it. We're not getting locked up at the sane asylum to live out the last 25 days of our life.
High anxiety. That's the movie that I was trying to think of earlier. I was like, what is the Mel Brooks? I was like, what is that Mel Brooks movie? I'm like, high anxiety. That's what it is. See, my brain. I'm like, I know it's something.
What about the medications that...
Yeah, what about
your Namendas?
Are you at liberty to discuss about?
Yeah, I mean, so
prescription meds that
people have a misconception about the frontline therapy for dementia right now is Aricept and Namenda, right? And people have this misconception that it's somehow curative.
Right.
It's not.
Right.
It's not a disease modifying drug.
Right.
It's a symptomatic treatment. And it only lasts for a certain amount of time. Once the disease takes over, it doesn't even help anymore.
Right.
So it's a symptomatic treatment for a short period of time.
Right.
But it's not curative.
Right.
And it does not. It's not a disease modifier.
Right.
People think like, oh, it's gonna slow the progression of the disease? No.
Right. It's going to help out on some of the symptoms.
It's going to help the symptoms.
Yeah.
But it's not going to change the progression of the disease.
Right. Right.
That's
It's
good.
it's just so interesting. I feel like the brain itself is just like the most interesting thing, and just in the way that it works and everything. And just, I mean, like you said, it's not a muscle that you can exercise.
Right.
It's just kind of taking care of the whole, takes care of the brain.
What about individuals that are obviously concerned? They have a strong history, like you said, of dementia or Alzheimer's in their family. At what point should they have a conversation with their primary care doc? Should they anything that, does that make sense? Should they look for genetic markers? So, in your
Well, in my experience, most primary care physicians just kind of
right.
brush it off.
Right.
They're like, you're 75 years old. Okay.
Right.
So we're expected, there's going to be cognitive decline just with the normal process of aging. And we define dementia as a decline in cognition that is above and beyond what you would expect for age. Okay. But, the 80-year-old memory is not the same as the 50-year-old memory.
Right.
That doesn't mean they're demented.
Right.
It's just, it's a product of aging. And so I think people should have conversations with their primary care, but don't expect them to take it seriously.
Right.
Yeah.
Doesn't Pennington offer help or screenings, or do they, with dementia, early detection or anything like
See,
that?
I'm so glad you said that.
There you go.
I have a patient who, I'm
Hey.
serious, whose mom she's struggling and she's young.
Mhm.
And we were talking about this. Why do you?
We have a study at Pennington that I manage. It's called Web LaBrains. And what it is, all you have to do is call into Pennington, 763-3000 recruiting, and they'll get you registered, and they send you a link to do cognitive assessment that's completely online.
Ooh.
So what that does is allows for early detection, right? I mean, if something pops up, then boom, we say, hey, you got to go see your primary care doc, and you need to tell them this is serious. This is not something to be played around with. This is not, I forgot to pick up my kid on this day or whatever. This is real. So we offer that
Is that a one-time thing, or do you guys?
annually.
So it's important. So it's the
you can
difference.
follow
Uh-huh.
it.
Yeah. Oh, it's longitudinal.
Longitudinal, right? So for our listeners, that means taking it yearly and seeing the changes, right?
Right.
Uh-huh.
And that would sort of bing,
Right.
a little alarm bell.
Right.
There's something.
we should start
That's an
doing that
excellent.
now.
I know.
Well,
Which
we
is an
had
excellent
we had
tool.
we developed a
amazing.
longitudinal study,
Yeah.
which was in person,
Uh-huh.
but the pandemic kind of
Yeah.
Okay.
killed that because people wouldn't want to come in. So we just
I don't want to come in.
redeveloped the program
Correct.
into something that
Which
was
is smart.
Yeah.
That's amazing. I mean, honestly, you could follow millions of people.
yeah. Oh
Right.
no, we've had thousands, man.
Yeah. I mean, no, it could be amazing. What were you going to say?
Do you want to know?
Yes. Kick me down.
No. Do you want to know?
Oh, do I want to know?
Like, there's
Do you
no
wanna
treatment.
know-
Wait, I know what you're asking him.
There's no treatment. There's no preventing it.
Okay.
Aircept
so
is short term.
Let me rephrase this. Okay. Do you want to know that? So essentially, like Rob said, when you're there, you don't know you're there, right?
Right.
Okay.
So,
Yeah.
So let's say, as a surgeon, I would want to know that I have pancreatic cancer. And I would want to know, and I would know that, hey, I walk in that door and they diagnose me, they show me my scan and it's, stage 4. I've got 6 months to 9
Yeah.
months to live. I would want to know that because I
Yeah.
would want to enjoy.
Yeah.
Because
Yeah.
you can probably can you assess somebody's status and say, hey, the progression of disease will be, I would assume with Alzheimer's, it's they can lay it out. I know dementia's different, but
there's no way to assess progression because it's individual.
okay.
And I think they would just base it off of
But you would
What they
know
see
where
with
you're
all
headed.
symptoms.
Yeah.
And I would certainly know that, better enjoy it.
Yeah.
Yeah,
Right.
take your ride.
Yeah, take your ride because you're going to
See,
forget it.
that's where I disagree.
Now,
I feel like you should
I enjoy
you
every
live-
single day
I was
like
about
that.
to say,
And I tell my wife that.
I feel like you should be
Gotta
living
live every day to the
every
fullest.
single
I
day
agree.
because
But some people, though,
some people need to
some
know. I
people
get it.
are like, I think about this all the time. I've got a friend of mine who he has a good living, but he spends a lot of money, doesn't save. And then, I'm a saver, and I'm like, maybe he's got it right.
Yeah.
You know?
Uh-huh.
Well, and the other thing about it
You're
is
so right.
What am I doing?
Also, like when Doc's like, I'm out, like for the next 6 weeks,
Yeah.
like, where are you going? Spending money, guys. Like, just burning it.
Yep.
Good.
the other thing about it is the stress element. Okay. So you're 72 years old
Mhm.
and your mom died of Alzheimer's and you're stressed and you think that's your path forward.
Right.
Right. And you can go into the Webler Brains program and take the test and it comes back normal.
Burn it up, right?
Okay,
Yeah.
this needs to be
the
like,
stress
huge.
goes
This is
away.
huge.
The stress
Yeah.
goes away. And
Yeah.
stress is
yeah, just as bad.
Yeah.
just as bad.
How
Yeah.
long does it take to fill
It's 30
out?
minutes.
30 minutes? Done. Taylor, we have 30 minutes.
Yeah.
Can we connect this at the bottom?
Yeah, I think that's
Yeah.
fascinating. I really
It's
look,
amazing.
I think that, as obviously our podcast's like, it's aesthetics, but to me, this is like, hey, takeaway is, hey, you're concerned and you have stress about this, go to Webler Brains,
Yeah.
right? Assess yourself, get involved in it, and it'll be a good indicator, right?
And a lot of times, I mean, like I said before,
Mhm.
if you feel like you're having memory problems, you're probably okay.
Right.
Yeah.
Because if
Yeah.
you're really having memory problems,
You
you
don't
won't know.
Yeah.
Yeah.
Mhm.
And so the Webler Brains project just gives that option for you to take that test
Yeah.
and for us to come back and say to you, hey,
Right.
everything's good.
Right. Relax.
Relieve that stress. That's
See you
one,
next year.
one less thing. See you next year.
Yeah.
That's so
We didn't get you a
interesting.
So-
Christmas present this year. You're
so-
getting either a ring or an Apple Watch, and you're clocking 10,000 steps.
Get your 10,000.
Well, that's I'm like, I feel like that's like one of like the easy things to do. I bet you get like 20,000
No,
steps a day.
10,000 is my goal because of
yeah.
mental clarity. Like I'm a better person if I walk.
Yeah.
Truly.
Because that brain's
Yeah.
getting that blood.
Yeah. And stress and
Brain.
You feeling better?
Yeah.
Your brain needs it.
Physical health equals mental health
Yeah,
very often.
truly.
But
Yeah.
that's also like crazy, like what you said in the beginning, that most of all of the studies and everything, or like the diagnosis of it is after death.
Yeah.
Because you think about it, I don't think people understand. It's like you can't just go like poking around in the brain
No.
Correct.
to,
You
to
can't,
like do.
you can't biopsy the brain.
You can't
Right.
just be like, oh, what's
Right.
this? Like,
Right.
let's cut that out and see what we're doing. And I think that's so
And the
wild.
point Rob made earlier, imaging does not mean disease.
right.
Disease does
right.
not mean imaging is the same.
Right.
And that's been the real trick and the real discovery over the last 20 or 30
I feel like
years
I've been
with Alzheimer's.
fooled.
Absolutely.
Yeah.
Absolutely.
We
Because
have been. There's
Yeah.
been a big change over the
Yeah.
last 10,
Because you could
15
see,
years.
because you could see somebody with a PET scan that's got like tons of amyloid plaques
Right.
and they're asymptomatic,
Yeah.
and someone who doesn't and they're sick.
Yeah. They're sick
Yeah.
and they have Alzheimer's and their brain looks healthy
Right.
on a scan. It's crazy.
So me and my cousin, my grandmother just passed away a couple weeks ago. She was 91. She had dementia. She developed the dementia like closer to 90 years old. And we used to tell her, she was like, donate my body to science. And we're like, nobody wants your body. Like, you're 90 something years old. Like, what are you going to do? Like, we used to always ask, like, what are you going to do? So sure enough, she passed away. Me and my cousin, who I'm the medical power of attorney, he's an attorney. So he takes care of everything. So him and I are getting together trying to figure out how to donate her body to science at Oshner on Friday night at like 10 o'clock, trying to figure it out. Sure enough, we get in touch with LSU in New Orleans, and we are able to donate her body to science.
Awesome.
LSU comes and takes her and all this kind of stuff. But I just think about it, like talking to you, I'm like, ooh, I wonder if they're going to look at her
Yeah.
brain because she's
Yeah.
got dementia.
Probably.
It's amazing.
I wonder
Fun
if
fact,
they're going to.
I am donating my body to science.
So when you
as well.
donate your body to science, they look at everything.
Yeah.
I know. I mean, like, that's so wild.
It's amazing. That is amazing.
My grandfather's like,
Amazing.
I'm going to do it too. And I'm going to tell you, it was literally the easiest
Yeah.
thing that I've ever. And
My grandparents did it. We're
so easy.
Love it.
Well, my dad did too. My dad was, he hated funerals. He was like, he said to me, he said, if you can't find something to do with me, put me in a burlap sack and throw me in a river. And so he made his dying wish to donate
Donate
his
to
body to
science.
science.
So, Rob, we are running out of time. I want you just to wrap it up and tell us one last, like, hoorah Give us some advice. Tell our listeners
Your
what
TED
they
Talk.
need to hear. Your TED Talk.
I'm dying on that hill.
Eat well, be active, and don't stress.
Amen.
That's I want everyone, we should have started the podcast with everyone who listens to this podcast, please listen to this podcast while walking. Like we
Yes.
should,
Which I do listen to
everyone-
most of my podcasts.
Yeah,
walking.
I'm like, you should absolutely
Yeah.
listen to this podcast while you're getting those
Yeah.
10,000 steps. And I know at the end of it, you're going to be like, oh, why didn't you tell me?
You're going to get old. I mean, the alternative is
Right.
that you don't get old.
Right.
You know, so embrace the fact that you're going to get old and try to mitigate it.
So good.
Yeah, that's why you celebrate birthdays.
Right.
So
So
good.
what's the alternative?
Okay, cheers.
I love that. I'm like, see,
So good.
that's why you celebrate birthdays.
so good.
So
that
everybody, make sure that you're moving your hiney all around, making sure you're getting the 10,000 steps, making sure you're eating the things. Remember, if it's good for your heart, it's good for your brain. Follow us, like us, follow us, subscribe, all the things. Listen to us on wherever you listen to your podcast. Make sure you're following us on social media.
Subscribe
Yeah.
below.
Make sure you subscribe.
And Webla Brains.
Yeah.
Web
Yes.
brains.
We're going to put the
We're gonna put that
Web
on there.
Brains thing because I'm absolutely taking this.
I think that's honestly one of the most amazing things
Truly.
I've heard in
That's
the last few months. Thank you.
Fantastic. So everybody go get in the study. This would be amazing information that we can have. Remember to always stay curious, always stay informed, and always consult before you cut. We'll see you guys next week.